All right, hi, I'm Janelle, cosmetic nurse practitioner. I've been injecting Botox fillers since 2013. I've got 3 medical spas. You can find us in Los Angeles and Las Vegas. So this is live. I'm in my pajamas. Someone's watching my kids right now, my brother. And so I like to come on here. We can go through questions, goals, tips on what to expect, how to prep for treatments. I can talk through treatments I have done. I can talk through patients I have treated, treatments they have done, and their before and afters. I'll click through these as we're going along. These are patients that my team and I have seen. Like I said, I've been doing this since 2013. We specialize in natural looking results, making sure you look like yourself, you look refreshed, never overdone. We treat all skin types and all skin tones, and I absolutely love what I do. If you have questions, please feel free to jump in, talk to me about any of these things. If you want to know what these patients have done, treatments we've done, we can totally do that. But as I'm just clicking through, I'm just showing you different faces, and I want to show you that, hey, you can get cosmetic treatments and look natural. You don't have to look overdone. And so this is what we're doing here. I will also talk to you about any questions you've got. I can talk to you about the most commonly asked questions I get as an aesthetic nurse practitioner, and just about what treatments can be done. So feel free to, if you want to invite yourself in the chat, you can do that. And in the meantime, we can go through some of the most basic ones. So things that I get asked a lot, like what do we do in our office? We focus a lot on skin health, hair health, and then natural looking injectables. We've got Botox, we've got filler, we've got all natural filler. And so we will be using different treatments depending on you and your goals. When we inject, we're really thinking about how are you aging? How is your face changing over time? And that's how we're trying to inject, so that it still looks like you and never overdone. I think this is such a great photo showcasing, again, natural aesthetics. We did something what we call facial balancing. That is where we're treating multiple areas of the face, making sure everything looks balanced, harmonized, not overdone. She came into me. This is Sujia. You may have seen it. Well, I don't need to be bigger. I'm trying to make her bigger, but she came into me and we did some Botox at first and some lip filler. And I was like, I think your lips look great. Your Botox looks great. And she wanted to do some more lips. And I was like, hey, we got to be careful. We don't want to just do lips here if we only do lips. And then we got these sad lady lines on the corners and your chin is kind of set back. It's going to look like you've got lip filler. And we want to do this where it never looks overdone. Thanks, Shantae. She said she looks amazing. So what we did here for her, we did a little filler into her cheeks, into the smile lines. As I said before, we've done her lips. We did some into the corners of the mouth and then into her chin. And then this area along the jawline, we call that pre-jowl sulcus. So this area, these jowl fat pads start to fall as we get older, and the jawline will look a little bit like this because these fat pads are here. So we blended that through. And I will show you from some different versions. Also, if you guys hear my kids, sorry, they're playing video games with their uncle and my husband. Okay. So you can see here from the side profile, you can see it from all the different views, but look at the jawline. It just looks a little bit straighter, and she has some more support. So since we went fuller on the lips, we don't want big lips that overpower the lower face. You don't want your lips to be ducky or like protruding past your chin. So we did some into the chin. Again, you can see the highlight on her cheek, and then the smile lines and the marionette lines, the corners of the mouth, are just a little bit softer. That's the whole goal. And then we also did her Botox. She just looks natural. Like, she can still move her face. You guys have probably seen her on social. Like, she makes videos. If you see her, she just looks fresh. And I love that. We did her treatments over some time. So we're treating multiple areas. I don't want you to think like this is a rushed thing. Like, we do some, I say, let it settle, reassess 6 to 8 weeks later. We can always do more if you want. The jaw or jowl filler is Botox or something else. So, hey, it could be a little bit of both. So you can do Botox into these neck bands. And I don't know if I pulled any photos. I try to put some pictures together to show you guys into the neck bands. So these little muscles here into the neck. And so usually that gets pretty close to where the jowl lays. So when you Botox here, it can tighten along the neck and make the jawline look a little bit straighter and tighter. It's not a necklace like surgery, but it does tighten things up. But we also, for her specifically, let me go back to that other view. We did some filler here and into the chin. So to elongate the chin and the jawline. And so then to like camouflage those jowls. So some people, I'm doing a little bit of both. Some of it is Botox into the neck bands to tighten in conjunction with filler or the natural filler. Yeah, it is really cool. And I think she looks great. And like, I feel like we can get close to surgical results without having to do surgery, and there's no downtime with it. I mean, she doesn't stop. She makes so many videos on social. I was like, she's like, I don't care. She's like made videos about the process, which is really cool because we're just trying to show that people can look natural. You can get Botox and filler and it doesn't have to look done. It doesn't have to look fake, crazy. That's always the intention when we're injecting. I really want to stay true to like you, your features, and your goals. So I ask a lot about like you and your lifestyle, what's going on, what do you do for work? You know, people are different. If I treat a sex worker and then I treat a pastor and then I treat a teacher, like everybody has a little bit aesthetic preferences that vary. And so this is why we want to know a lot about you. She looks younger. Yes, Shantae, I think she looks so great. And she just says she feels like the outside matches her inside. She just turned 50 the end of last month or earlier this month. Penny said you got your first ever Botox. I'm so excited for you. I think you're going to love it. Let me show you guys some Botox and what that can look like. You guys, I know you hear my kids squealing over there. They're laughing. So Botox, I think a lot of people think if you get Botox, it's going to be like so plastic. I'm like, it doesn't have to be like that. It doesn't. You can do it to where you can still move your face. You can still animate. Let me see if I can make her bigger without making me bigger. Oh gosh, sorry. Okay, so she came in before her wedding and she was like, look, I want to do some Botox. I just want to kind of, you hear my kids, soften some lines. She had lines in her forehead around the eyes that she felt like were just getting a little bit deeper, and she just wanted to soften them, but she still wanted to look like herself and natural. So we did Botox. You can see, and we started on some skin regimen, but you can see the lines are like not getting etched in on the skin. They're smoothed out. She can still smile and move her face. Like if you saw this girl walking down the street, you wouldn't think, oh, she's Botoxed. That's the goal. It's just going to look fresh and look like you. So Penny, I'm super excited for you to do it. I think you're really going to like it. You guys, when you're doing Botox, how much you do really depends on how strong your muscles are, how big the area is that we're treating. Someone with a bigger forehead will take more. Did I set up the boys picture? There I had some boys on here too that had some Botox. Oh, here's another Botox photo. She like didn't want to be completely frozen. She's just like, just soften some of the lines, but don't make it all the way frozen. So that is really on your provider to be able to like get the assessment from you, talk about your goals, and then deliver out the treatment plan. So she's like, look, I like my lines. I don't want them frozen. I have some people that do that for acting. I'm a teacher or I'm a mom and I still want to like frown at these kids. They don't need to like be super frozen. So that is the goal. Communicate with your provider, communicate with our team when we're doing stuff so that doesn't have to look, so it can meet your goals. How often should you get masseter Botox to maintain results without overdoing it? Usually for masseter Botox, let me see if I have a picture here. I would say about every 4-ish months, 3 to 4 months. It really depends. So when we're doing masseter Botox, I'm trying to see if I snapped the photo. I have to like set all these up before I come in, but I have like hundreds, if not thousands of photos, guys. And I just can't take them all. So I was just trying to snap them really quick before I came. But masseter Botox, this is not a masseter Botox. This is just, I'm just flipping through somebody else. But masseter Botox, when we're doing Botox into our jaw muscles, we use these jaw muscles and they're like overused. You feel like you have TMJ symptoms like clenching, headaches, teeth grinding, jaw pain. Masseter Botox, that means Botox in the jaw muscle, can help frown at these kids. I need to frown at mine. They're like playing musical instruments and the next video game that I got off TikTok, by the way. So it'll relax the muscles from flexing so hard. And so then that really helps relieve the symptoms, the jaw pain, etc., the tightness and the tension. Sometimes we're treating the temples as well. Both of these are chewing muscles, so it depends on what's going on. And then it can slim the lower face. I do have some really good slimming photos to show. I just didn't set them up in here, but it can slim the lower face. So I give people a heads up. A lot of people really like the slimming effect because they will tell me over time when they're like biting down all the time, they notice their jaw is getting more square and wide. And so when we relax the muscles over time, it starts to slim the face. A lot of people really like it. If they don't like it, that's when we have to talk about, should we do this? Should we do less? Should we do it less frequently? We have to talk through it. Does it sculpt the jawline too? Sculpt? I don't know exactly what you mean. I mean, like, I know what the word sculpt is, but I don't know, like, what exactly in your mind, what you expect it to look like. It can slim it. So I think, but sculpting, if you're trying to like, this is what I would consider a little bit more sculpting of the jawline. This is a little bit more like sculpting. And this is when we're doing some chin filler. So I'm just trying to click through some. jawline, if somebody feels like they want definition here, that is where I'm doing like filler or the natural filler along the jawline. Sometimes it might be in conjunction with Botox into these bands. You see me flexing these? Oh gosh. To tighten the bands. And so that will help along the neck. But I mean, again, you know, surgical-like results without having to do surgery. We just want to not have it overdone. Here's somebody like immediately after that we did. And so like, it's a little extra because it's like a little swollen. It's not going to stay like that. So you can bruise, you can swell. 2 to 3 weeks, I say. By that point, you should have a good idea of what your result will be. But 6 to 8 weeks for the product to completely settle, and then we can see you back and we can do more if you want. If you're like, I liked it swollen. I liked it when it was more chiseled. So we do it on men, we do it on women. Let me see if I have some other guys on here. I'm just trying to swipe through my phone. So some guys want to make their jaw more square, more pronounced. We can totally do that. We can do it into the chin. So he wanted some mid face like volume, as well as he wanted to be more angular, more wide at the lower face and more squared out on his chin. So, okay. Holland, hey, you said, is Sculptra a good choice in the jawline? Depends on what you want to get out of, like, for your results. If you're trying to really get more of like contouring definition, I think it's okay. I think you can probably get a better result with traditional filler like hyaluronic acid or Radiesse, a calcium-based filler, or your all-natural PRF, the Easy Gel. And I can talk through that. Sculptra is a collagen stimulator. It'll make new collagen over time. It's just gradual. It's not super quick. Can I make this straight, guys? Like, I don't know how to make it straight. But you get the point. I'm just trying to show you different patient before and afters. Usually I just have my own before and afters up here, but I just needed time to set up these pictures. Okay. Wow. You guys have great results. Thank you so much. These are patients that we have treated. I've been doing this since 2013. As a cosmetic nurse practitioner, I have a team that we see patients in, we have 3 locations, 2 in LA, 1 in Las Vegas under Jossie Skin and Wellness. It was formerly Janelle Beauty. Like, we're switching the name like this Monday. So, if you look under my name, Janelle Beauty, that's where you'll find like all the information, read reviews, see patient photos. But we're gonna have a new website, Jossie Skin, JASI, this upcoming week. Hi Tony, I hope you're doing great. Let me see if there are questions that I missed. I'm trying to go through there. I don't know your name, but it said, Heart, I got TMJ Botox at your clinic today. It's helped so much with my pain. I am so happy to hear that. So that was what we were talking about earlier, guys. TMJ Botox, or Botox into the masseter, to help with clenching, headaches, teeth grinding, jaw pain. People say it changes their lives. They're like, I don't have to wake up in pain. I'm not breaking teeth. I'm not having headaches. I can go to work and school and like function normally. Okay. Cosmic Being said, what about smile lines? So smile lines, when we're doing smile lines, let me see if I got photos. I'm going to try to just flip through some. These are not specific to smile lines. These are just some patients that I've treated over the years, and my team and I. So smile lines, some tips here. I tell patients, we're not trying to get the line all the way gone. Like, that's not the intention. If we get this all the way gone, guys, like, it's going to look weird. It's going to look a little puffy and blown out. You don't want that. So for smile lines, you can soften them with filler, traditional hyaluronic acid, calcium-based filler. You can use collagen stimulators like the natural filler or your Sculptra, just depending on like what your goals are. So there's different ones. Sometimes people will do like filler and the collagen stimulator. If you want like a quick result, that's when you're going to go like with your regular filler. If you want a completely natural, I don't want to have anything else, only something made for me, that's when you go with your natural filler. So that is PRF Easy Gel. That we draw your blood. We spin it in the centrifuge, in the spinner, and it separates your growth factors and your stem cells. We take that part out and then we heat it and cool it, and it makes a gel. We can place that anywhere in the face, and the smile lines. It's like one of the most commonly requested areas, and underneath the eyes, and it'll help make new collagen over time. So you can do the natural filler, and a lot of people like that. You know, my patients, I won't even say just the younger ones, but like a lot of people are like, hey, I just don't want filler. I'm nervous about it. I'm not a candidate for it, whatever their reason. And I want more of like the collagen stimulating. And I understand that it can take a little bit longer to see the results, and they're okay with that. That's when we'll go the natural filler. I've been doing it. I should keep flipping. I'm sorry, they're crooked. Oh no, guys, I'm trying my best. I've been doing the natural filler for the past 2 years. I haven't had any regular filler for 3 years. I've got a 2-year-old. I'm surprised he's not like running in here because he's done that before. I'm breastfeeding. I have 3 kids and I've breastfed them all for 2 to 2.5 years. And so usually, and I have my picture up here, but I can't find the other one now. It shows my before where I've never done anything. And then I looked really like sunken. My eyes were really hollow from breastfeeding and losing fat in my face. This time around, I'm 38 and I've been doing the natural filler and I love it. So I don't even feel like, I'm not going to say I'm never going to do filler because I love filler, but there's no spot where I'm like, that the natural filler hasn't performed or I feel like I have to get filler. I really like it. When I first did it, I was like, I don't see any change. This didn't do anything. Gradually over time, I'm like, dang, I don't look so beat up. I don't look so haggard. So I like it. I think it's wonderful. I will say it's not instant. Okay, let me make sure that I'm answering the questions. Sorry. Let me go back through. Okay, how long does PRF last? So with the natural filler, your body's going to make new collagen in that area. Once we make new collagen, that we're losing collagen, guys, like mid-20s on, we're just losing it. But once we make new collagen, it's going to last for years. However, we keep aging, and I try to tell patients, I'm like, do the good, healthy lifestyle things. Do the basic stuff. Wear your sunscreen. Have a healthy diet. Be hydrated. Stay out of the sun. All those basic, don't smoke. Don't minimize drinking. All of that, because that's going to allow your body to maintain that collagen longer. So for years, you're going to get new collagen, but the healthier you are and the better you can maintain the results, that's going to be the better the outcome. Let me see. Thank God for being Somali. I've treated all the patients though. I've treated patients from there too. What do you recommend for wrinkled neck skin? And then, I have good pictures of that too. I just did not snap them on this for today. For the neck, if you have these bands, Botox is an easy thing to kind of tighten through the neck, until the neck bands, the baptismal muscle. And I think I posted a video showing what some of those look like, but I have more pictures. So you can do Botox there. That is straightforward and easy. For texture, use your sunscreen, use your retinoid at home, do your part. And then you can do skin treatments. Microneedling will help. Your chemical peel will help. Your laser will help. And then if you really are like, I'm trying to get this and I want to see it faster, that's where I go in with Dilute Radiesse. It's a calcium-based filler, but when we dilute it down, there's collagen stimulating properties in it. And so the collagen will help give some tightening effect. I have some really, really pretty before and afters of that. That is wonderful. But you kind of want to do, again, the basic stuff, your sunscreen, your retinoid. When you're doing your skincare, guys, bring it all the way down. I got nothing on right now except some vitamin C because I wash my face. But do your skincare, do your neck and chest. Some people are good about doing just their face, but then their neck and their chest, it doesn't match. It doesn't match. So you want to be mindful as you're doing that. Those are simple, easy things. Okay, I've been curious about tip filler. My nose feels a little bit flat and boxy. Would you recommend it? So you can send me a picture and I can check out your nose and I can show you some noses. I think I put some on here for today. So it depends on what you're trying to do. So he felt like his nose angled down. He wanted a fuller nose. And so we try to get the point of it to angle upwards. Here's somebody, she wanted to straighten out the bridge of her nose. She had a little bump and she wanted the tip to face upwards. Here's a nose from the front. People be like, oh, can you treat it on? I treat all the noses. I treat all the skin colors. I treat everybody. So here's somebody with a fuller nose. I won't, if somebody's like, I want my nose really pinched in, I'm like, I'm not going to do that. But it can create a highlight down the center. So we made a little highlight. So people will tell me hey, my nose looks more contoured. Or hey, if I'm trying to contour it, it's way easier. Or I don't have to contour it. It gives them a little bit of height along their bridge. And the light reflects off of it differently. So then it looks a little thinner. Here's some more noses. She had a bump and we wanted the tip to go upwards. These are things that you can do without surgery and there's no downtime. And noses, oh my gosh, I feel like people cry when they get that. They're so happy because they can see it instantly right then and there. Nobody's going to know this girl did her nose, but she was probably really concerned with that bump. And that's who it's for. Here's some more noses. She felt when she smiled, her nose curved down. We did some filler to help it to swoop upwards. She wanted to swoop up. So some people want to swoop up, some people want it straight. Really just depends on your goals. I'm trying to see if I lined up any other noses through here. Noses, when I do it, I say do it over 2 sessions. Do some, let it settle. reassess, come back. You can always do more. We wait 6 to 8 weeks to build on that initial foundation if you want. Okay, let me make sure I'm not, sorry. Botox. Hey, how are you doing, Earthly? Do I travel to Arizona? Not right now. We have clinic in Vegas in LA. So if that's close enough for you, I don't have my license there. But I will work on that one. In Arizona. Okay. We talked about the neck skin. Okay. And then we talked about PRF. Okay. So I think I caught up to the questions. I can flip through more photos. If you guys have any questions, then I can just talk to you about what these patients have done. I've treated a lot of these people for years and years and years. I've been doing this for almost 13 years. And like my patients, they just keep looking like themselves and fresh. And like, I will tell them no. Like she came in, I saw her when I was in Vegas a few weeks ago. And she was like, should I do my lips? And this girl's freaking beautiful. I'm like, girl, like your lips are holding. Like we don't need to do the lips. She's like, it's been a year. I'm like, your lips look great. Like we don't need to do it. And so we really were working on skin treatments. So it just depends on the person, what's going on. Results with your filler I tell patients 1.5 to 2 years, we check in. Most people are going to be, when they come in, I'm like, dude, I don't know if you need this. Or if we're doing something, it's less that we have to do to maintain. It's like, we're not having to do a lot. Again, I really focus on skin health. So I'm like, at home, guys, do your basics, your sunscreen, your retinoid, reapply your sunscreen. Earthy says she wants it on the forehead, the Botox on the forehead. Let me show you. How did I put my pictures back? I think Botox on the forehead is so nice. Like here's somebody that didn't want all the way frozen. She's just like, please soften them. Here's somebody that like, you can see it's like smooths out the lines on the upper. I reposted a video on my stories of a patient today, a Black woman. I just like to show all the different faces so you can see somebody who looks similar to you. God willing, that's my intent when I'm doing this. And I really shout out to my patients for letting us to share these pictures, because if they didn't consent, like, you know, you wouldn't know that these people have done stuff. So that's the goal. But I reposted a video one of the patients made. She came into the clinic, she got her Botox, and she kind of showed you like, hey, this is what it's like before I came in. Like, look at these lines. This is what concerns me. And then she showed, this is me day 2, day 3, day 6, day 7. And she's like, look, I can still move my brows. I told them I want to have movement. So it's just cool because you can see, and we do a lot of communication with you to find out your goals so that we can do, like, we don't want to just give everybody the same thing. That's not what we do. Earthy said, what is a filler? So filler, we're going to think of filler as like when we're trying to restore volume, plump, lift an area, hydrate an area. That is your filler. So people will use that commonly underneath the eyes, into their cheeks, under the eyes if they feel like they're sunken or hollow, if they feel like the smile lines are deep, if they feel like they're seeing the corners of the mouth turned down, if they're trying to contour along the chin or jawline. Temples, we lose volume. So we're trying to like re-volumize those areas. Whereas Botox is going to be for stopping the muscles from flexing so hard. So like, oh, I don't want these frown lines. Botox there so you don't frown so hard. It relaxes the muscle. Okay. And a lot of people are doing most of them. No movement is necessary on my forehead. I'm 54. So you just tell me what your goal is, and then that's how we dose you. So how much we do depends on how strong your muscles are, how big the area is, and then what you want the outcome to be. I have some patients that are like, I see every time I'm in clinic, somebody has flown from somewhere else. So I connect with so many people here, and a lot of people are like, no, I've been following you for years. Again, I've been doing this since 2013. So I have some that are like, I'm coming once a year or twice a year, like freeze me up. And I'm like, okay, if I freeze you, like it's going to last a long time if we freeze it up, but like, they're going to be like, I'm going to say frown, and they're going to be like, I'm frowning. I'm like, I'm frowning. So just so you know. However, even when somebody's frozen, I'm like, can you still get your point across? Like, do they know? They're like, oh yeah, my attitude, it goes through the Botox. So just so you know, it's not like this crazy looking thing. Okay. What do you recommend for puffy jowls? I'm almost 50 and starting to see them. So for jowls, we were talking about this one earlier. This is where people will feel like heaviness right here and like kind of saggy along the jawline. She has a thinner face. Sometimes people have a fuller face. So similar approach, but it really depends on your face, and we got to like assess. So for her, so remember, jowls are starting as we like, our fat pads start to separate, they start to sink, and this keep coming down, down, down. And so then here, the jawline will look irregular. So first you can do a little bit of Botox, into these platysmal bands, into the neck muscles. That's like an easy one. And you can just say, okay, did that give me enough? If it's not enough, or if you're like, really, I want to get a result like this to where it looks way smoother along her, you can see like this doesn't look like it's hanging anymore, guys, right? That's where we're doing filler. So we did filler into this area called pre-jowl sulcus, pre-jowl, like in front of the jowl. And we did some into the corners of the mouth, into the marionette lines, and then I did some into her chin. If I only went here, it could make her face a little bit wide. So that's why we elongated the chin a little bit so it's not wide. And yeah, like I feel like it like looks so great. But I will do a similar approach for somebody with a fuller face. Also, you can do Kybella. Kybella is a permanent fat dissolver. It can take, you know, a couple sessions, but it can dissolve some of that fat right there. So that's another approach we can do. These are all the non-surgical ways. And then I tell people, if you're open to surgery, like get a surgical consult. Don't have to rush when you're doing any of these treatments. I want you to make informed decisions. This is why I get on. This is why I talk about it. This is why I try to showcase patient before and afters. I want to educate, and I tell people, I'm like, don't rush. It's your face. Like, be smart about it. So that is super important. But that is what I would say. Maybe some Botox, some filler or natural filler into these areas, into this lower face to camouflage the jowls. Or you can do some dissolver into there. I see some people, if you want to like reach out, you can totally send me a message on here, or you can text the number at the top of my page. I see all those messages that go through, and my team also will help me. So these are girls that I've worked alongside with for years, and they see the patients with me in the clinics. And so they just help me manage like appointments and getting back and scheduling and all of that. We will do virtual consults. I mean, I virtual consult almost every person that comes in, or my team. Like I have another nurse practitioner that does them. We like to go through questions, your goals, tips on what to expect, how to prep for treatments. We want you to like be ready before you even come into the appointment. So we'll say, okay, before you come in, we want you to start taking arnica. We want you to avoid blood thinners. We want you to avoid alcohol. Is this a good time? Oh, you're about to get ready for a big event. Okay, let's plan, like we need this much time before it. Or, oh, you're going to be on this big flight. Let's plan for after. So we want to talk through everything. And just make sure you're a candidate for it. You know, if somebody's just like, I only want this. And I'm like, I realistically can't achieve what you're asking me. You know, I don't want them to have to come. Again, a lot of people are coming from outside of LA. I don't want them to like waste their time. So this is why on a virtual call, we start developing your treatment plan right then and there. Okay, let me make sure I'm not missing messages. Sorry if I am. If he looks amazing, thank you. I'm a Scorpio. I get it. Okay. Other treatment. So the natural filler, I talked to you guys about that one earlier, and I mentioned this just because so many patients love it. And a lot of people, I think people are like afraid of Botox and filler, and they think it's going to be this crazy, crazy thing. It's really not. Like, it's really not. I've been doing this a long time. You want to go to somebody who's skilled, who treats faces that look like you, who gets great results, that can show you several before and afters, that read their reviews. It's really important. You get a referral from someone, like don't rush. But you know, sometimes people are just like, I don't want filler. Like I'm still like nervous about it, or they're not candidates for filler. So the natural one, we draw blood from your arm, we spin it in the centrifuge, and it takes out your growth factors and stem cells, and we heat it and cool it, and it thickens into a gel, and we can use that in the face. So I've done my whole face with it because I can't do filler for breastfeeding that baby, and I really like it. And it's not just me. I have patients all from 20s to 50s. Like once we start getting mid 60s is where I'm like, hey, I just don't know how much your body is going to be able to make new collagen. And that's where we're probably talking more so about filler. I've had patients in their 60s do it. Usually they're like, okay, I want a faster result. Or I had one lady, she was like, I'm just old. Like, give me the filler. Like I've gone through some pokes in my face. I know what it's like. I'm not afraid anymore. Give me the filler. Like I like it when it's swollen. Give me the filler. But the natural one is great for collagen stimulation. I think that, you know, aesthetics is probably going more in that direction of like more regenerative medicine, more of collagen stimulation. So yeah, but filler and Botox can be done so beautifully. She's done Botox, and all these patients I'm flipping through have done Botox and filler, and they look great and they look like themselves. I'm like, that's the point. Can I put a picture on here for you to recommend what can I do to my lower face? Yes, you can. Or if you want to like come on here, we can talk. I don't even know how to put the picture on there, or you can message it to me. So if you message it to me, I can voice message you back or type you back and give you any recommendations, or you can set up a virtual call. So yeah, yes, I really think so. You know, people, that way we're just not filling and filling and filling forever. Any more images of women of color? I have so many. I will flip through here real quick, and I'm going to talk real quick to Sammy, I think her name is. We see all the women. We see women, men. We see everybody, all ages, I do faces. My team and I do faces. So we do all the colors, little lip, big lip, old lady, young lady. I got it all. And these are just some, guys. I've got like thousands of photos. I just tried to snap some that I had on my phone today to set up for the live really quick. Okay. Where did it happen? She was on here. Okay, if you want to come back. Oh, let me see. I don't want to mess it up. Oh, okay. This is Dorothy. Am I messing it up, guys? Okay. I want to make sure I can chat with whoever, but I know Sam, I was trying to talk to you, but I kept running my mouth. I'm so sorry. And then Dorothy's coming on, and let me put to... Hopefully I can get Dorothy on here. How much is a natural filler versus others? So the natural filler, we do it in 2 sessions. The 2 sessions, it's $25.50. All of our pricing is online too. Guys, sorry. If you were trying to come in here and like I messed it up, you can send me a message or you can try to come back. I hope I didn't hang up on you. $25.50, it covers 2 sessions. And usually with the natural filler, we get like 5 syringes worth when we do the blood draw. 5 syringes worth. It can be split up in different parts of the face. Most commonly, like people will do under eyes and smile lines. If we start trying to spread the natural filler to, like if they're like, do my temples and my eyes and my cheeks and my, all the smile lines and my lips, I'm like, we just need more. So I have some people that will double it up. And I think it's $3.50 to add on, like to double it. If we double it, I can hit all the spots. But I just don't want to spread it too thin. And then we have you come back in a month. The second time you don't pay, it's already paid for up front. And then we retreat those same areas. Okay, if you wanted to chat, there was somebody earlier, and I just feel so bad. I don't know if I messed it up, but you can come in here and I will do, like, we'll talk one-on-one. Somebody said, what did she do in this picture? She looks so great. So she did, I think this is just one view, but I've got other views of her. She did some filler into her lower face and into her cheeks. So she's just like, she's beautiful. Like, she doesn't need anything. She's like, I just want to look more snatched. But she felt like, you know, relative to her fuller cheeks, that her chin set back, the lower face was more placed back. So we did some filler into her chin, and then we also did some into the lateral part of her cheeks, so she gets a little cheek highlight. And it looks great and it looks nice. And like if you saw that girl walking down the street just in the after, like you wouldn't think she's done stuff. And like that's the goal. How much could the natural filler last? You mean PRP? Thank you. So the natural filler, it's PRF, platelet-rich fibrin, and PRP, platelet-rich plasma. Oh, I see you on here, Sam. I'm going to make sure I talk to you. New collagen can last 4 years. You want to be healthy. Hey, Sam. Okay, I messed it up earlier, and I don't want to mess it up again. Natural filler, we make it from your blood completely, your body's growth factors and stem cells. Sammy, I'm going to try to make sure I can see you on here. And thanks for coming back because I like hung it up on accident. The links aren't working when I go to the Jossie site. Oh, that's because we're getting a new website like this upcoming week. But if you text the number, so right now, guys, the website's been under my name, Janelle Beauty. But I'm switching all the name out to Jossie, Jasi. Jossie has just been our skincare for the past few years. But now it's going to be our clinic. Hey, how are you, Sam? Can you hear me?
Yes.
Oh, let me see if I can hear you. I gotta turn my camera up. Hey, nice to see you. Okay. Now, you wanted to ask me about lower face?
Yes.
Have you done any treatments before?
The upper.
Okay. Like Botox?
Yes.
And then let me see you from the side. Okay. And then is this your standard weight or are you like changing weight?
I'm like 10 pounds from where I want to be.
To lose or to gain?
Lose.
You're going to lose 10. Okay, so I would probably get closer to your goal before you do stuff just because as we lose weight, we lose fat in our faces and things start to like shift and sink down. But for through here, I would be doing like filler or I would probably, how old are you? You don't mind? Tell us.
Do I know?
I said, how old are you?
60.
Okay, I would do dilute Radiesse and regular Radiesse. So Radiesse is a calcium-based filler. It mimics bone. It has like the most projection out of all the fillers that we have FDA approved on the market. So I like that for right here along this jawline area. So here, as everything was like sinking, as we losing weight, And just with age, things will come down here. So you want to camouflage the jowls, and then this little like crease above the chin, we're just losing volume. So I would use dilute radius for collagen stimulation, and it'll give you a little bit of an instant lift with it. So that's where I would go. And you can use that dilute radius like in through this area where we lose fat as well. So us losing fat just happens with aging and then weight loss. If you're losing weight, people will lose fat in their faces as well.
You said it's called what now?
Dilute radius or radius. Radiesse. That's what I would do, like based off what I can see. But it's basically some filler into there. And if you
What about?
Oh, go ahead.
I'm sorry.
Oh,
And for the neck.
So into these bands right here, I would do Botox, and Botox will tighten those bands so they won't like show so much when you talk and animate. So that'll like make the neck look a little bit tighter. And then you can do that same product that I was saying in through this area, that dilute radius, you can do in the neck. But again, these are the non-surgical ways. If you're like, hey, I want it like pulled back and tight, I always encourage people, I'm like, know all your options and like get a surgical consult if you want. And sometimes they might like do fat as well, fat transfer, in addition to like a little nip and tuck. But I feel like you can get, I think just even a little volume in the face will make things look more youthful and just soften some of the shadowing. It'll look nice and not like done, but it'll just look good.
Okay. Thank you very much for helping. That was very informative.
Yeah, you can send me a message if you want, and I can like type it out to you. So
okay.
All right. Have a good night.
Thank you. You too.
Bye. God bless. Okay, let me see, and I don't know how to turn off this.
I don't either.
Let me see if I can. I might need you. Let me see. Okay, I'll see. I think I can disconnect it. Bye.
Bye.
Okay. Then it makes me blurred on here. I don't know what to do. Also, Sculptra. Oh, Ashley said she found the site. Oh, look, my husband is joining in the live. He starts joining in when he's like, come get these kids. So yes, Ashley, next week, the website, it's just, like I said, it's been under my name. We're switching it all out because it's not just me at the practice. I have other providers who are excellent. I would never like be working with people that I didn't think were excellent. And now I'm blurry. So it'll be like way easy to book online. All this, like I just streamlined everything. Right now I feel like we have all these like random pages. I'm like, let's just get to the basics on what we do. I don't really care about the SEO having a page for every single part of the face. But yeah, I would love to see you, Ashley. If you want to set up time to consult, we can do that. Like I said, you guys can always message me on the page. You can type the number like 424-218-4023. You can message that, text it, or call it. That my team is on there, but I see all the messages that go through. You can DM pictures there, or you can DM them here, and I can try to like, hey, give you a voice message and recommendations. If I'm giving recommendations, it's never ever out of like, first, I never want anyone to feel like they got to do this, and I'm never trying to do anything out of like to make you feel bad about something. That's not in my heart. Okay, Alibit, I'm trying to see if I can get you on there. I can hear you, and I can't see you. Do I do laser at our practice? Yeah, I haven't even talked about the skin treatments today, guys. Yes, we have Aerolase laser, skin pin microneedling, hydrofacial, and bio-repeel chemical peel. Everything can be done on all skin types and tones. Alibet, if you want to try to come on, I was trying to get your camera on, but you can come back in if you like. Sorry. And if I don't get to talk to you, if we can't figure it out, Alibet, just message me. And so I love, guys, I'm blurry now. I love the laser. I love all the treatments. Anything I tell you guys, like, I'm going to stand behind it and I'm going to do it. And I do it on myself and my family. But the laser is great for acne, for hair removal, I had all those like DP and like little Morgan Freeman moles. I had them all over after my last pregnancy. I'm going to have to go in a minute. Zap those off. Just overall skin rejuvenation, collagen stimulation, no downtime with it. And it's safe for all skin types. Again, I see all the people, guys. We see everybody here. I see all ages, my team, like this is what we do. I'm just trying to get through there so you can see all the different faces. We see everybody in the office every day. So I need to have treatments that are going to work for everyone. This works really well. You can combine the laser the same day with microneedling, with the BioRepeal chemical peel, with the hydrofacial, depending on what your skin concerns are, how aggressive you want to be. So we can do different things. We really tailor these treatments to you and your goals and what's going on in your downtime in your life. So we ask a lot of questions because we just want to make sure that the treatments will serve you. I'm just trying to show you, we see everybody. So that's just what we do. A hair program, forgot to talk about that. We have a whole hair program in our office. This is for people that are noticing like hair thinning, hair loss. We have it for men and women. We do a scalp detox facial to like debride, the hair follicles so that the follicles can grow. We're also bringing blood flow to the area so the follicles can grow. And then we do the same where we draw the blood and we do the PRF injections into the scalp for hair growth. This is him after 3 months. We can do it with Nutrafol supplements and or prescription medication like minoxidil topically or orally. And we've done more. Like his photos are even better. Now it's just like all grown in. And he's like, I used to get haircuts every 2 weeks. Now I get them. They want me to come every week. He's like, my hair is like growing so much. So it's so great. And all hair types. LipoLab. I don't know. Lemon bottle. I don't know about the lemon bottle. If I knew Eccentric, I would tell you. I felt like I was hearing about that a little bit like a year or two ago, and then I haven't done too much after that. How about laser on black skin hairline? Do you recommend to sculpt the hairline? You can totally do that. We don't want to like go over your eyebrows. Boys, if they don't want their facial hair, we'll do that. But yeah, it does hair removal and it works very well. As long as the hair is dark, if it's blonde or silver, it doesn't have pigment in it for the laser to pick up. So that's something. Oh, I'm messing up my thing over here. Do I do laser? Yes, we do. Okay. Alibet, yes, I know you were trying to get on here earlier. You can send me a message. Anyone on here, you can call or text the number. You can DM me if I'm not quick to the DMs. I'm sorry. It's because I'm about to go run for these children in a second. But I see them all, and especially if you text. If you text it, I know I won't miss it because my team is like giving me a hand. But like I said, we'll set up some time to consult. We'll go through your questions and goals, tips on what to expect, how to prep, like what we did earlier when Sammy came on. That's like a very quick consult. The consults that we do are usually around 30 minutes because I'm asking you a lot more in depth. And like, that's what I'm saying. What's going on with work? Oh my goodness, my husband is like on here, guys. He's like, come, Kenneth Brown, DDS, keeps getting in here. So that means I got to go help with these children. What's the number to text or to schedule? So it's 424-218-4023. It is at the top of my profile. So if you type that number in there, you can text there and we'll get back to you. And you can send pictures there. It's a HIPAA compliant line. Your pictures aren't going anywhere. So yeah. Desi, the long-term side effect of Botox and fillers. I mean, I've been doing it for 13 years as a provider and I have just seen great outcomes, but you want to be smart about how you're doing these. Big things is you don't want to overfill. Some of these people I've been seeing my entire career and they look fresh. And like, I have to say it's shout out to the patients for like letting us use their photos because you wouldn't think that these people have had Botox and filler. And that's why I've tried to show like these things can be natural looking and you can look like yourself. I'm not trying to have every face look the same. Like I want you to still be you. That's how we inject. Yeah, so it's just like, we're not going to overdo it. People will come in, like I said, this is my girl. I've seen her for probably 8 years. She came, she's like, should I do my lips? I'm like, girl, no, you're freaking perfect. Stop. We're not going to do some lips. We'll do your chemical peel today because she's getting ready for her weightlifting show. Like, we're going to make you just, your skin glow, but we're not going to do things unnecessarily. We don't want to overfill. We don't want to overdo. So that's the biggest thing. And like natural is the goal. That's like what we're trying to do. We don't want it overdone. But, you know, if somebody wants a glam, like she already had great lips. So she's like, I want them bigger. And when people like, do black girls do lip? I'm like, yeah, they do. Like they can do lip filler too. Okay. I'm going to jump off of here. If you have any questions, please feel free to message me. Texting the number will really make sure that I don't miss it. And we'll love to set up some time to talk with you. I appreciate you guys. I hope you have a great night. I will come on here, God willing, tomorrow. And I'll talk to you soon. God bless you and bye.